Buenos días, buenas tardes a todos
Good
los
morning, good
participantes en este
afternoon
webinar.
to all of the
Les
participants of
damos
this webinar.
la más cordial bienvenida al
We welcome
webinario
you
titulado
cordially
Datos para la acción,
to
monitoreo del
Data for
progreso hacia la
Action
eliminación de enfermedades transmisibles
Monitoring
en las Américas.
Progress
Tenemos servicios de
of
interpretación
Disease
simultánea
Elimination in
en inglés,
Americas. We have the
español,
simultaneous
portugués
interpretation
y
available
francés.
in
Por favor,
English,
siéntanse en
Spanish,
la libertad de
French, and
usar
Portuguese.
el
Please
canal de
feel
acuerdo a
free
su
to use
preferencia.
the channel
También
you
tenemos
prefer.
habilitada la opción de preguntas y
We also
respuestas,
have
en
the
donde les
option
invitamos
to
también a
ask
postear
questions and
las
answers.
preguntas que
We'll be
ustedes tengan.
posting
La
whatever
Organización
questions you
Panamericana de
may
la
have.
Salud lanzó la iniciativa
The
de
Pan American
eliminación
Health
de más de
Organization
30 enfermedades y
launched
condiciones relacionadas en el
this
2019,
program for elimination
la
of
cual
over
tiene
30
como meta
diseases in
fortalecer y acelerar
2019. The
acciones
goal is
cuatro líneas de
strengthening
acción:
and accelerating
acceso a
actions
servicios de salud
against
integrados,
these
fortalecimiento de
disease,
los sistemas de vigilancia e
integrated health
información,
actions,
fortalecimiento
disseminating
de la
information,
gobernanza, la reforma del
strengthening
financiamiento y
governance,
enfrentar los determinantes
financing,
sociales y ambientales relacionados
and
con estas
confronting
enfermedades. Los países de
environmental
la
and
región de las
social
Américas están
factors in
avanzando
these
en
issues.
formular hojas de ruta para
We
acelerar la
have
eliminación
been
multienfermedad, y un
constructing
componente
roadmaps
primordial es el monitoreo
to
para la acción, y de
take
eso se
on a
trata este
multi-disease
webinario hoy.
approach.
Nuestros objetivos hoy son tres.
Our
Vamos a
objectives
presentarles
today, there's
la
three of
estructura,
them.
características y funcionalidades de un
Structure,
nuevo paquete de
characteristics,
datos
and features
indicadores que
of a
monitorean
new
acciones
data
en las
table,
cuatro
which will
líneas de
be
acción de la
monitoring
iniciativa
actions
de
on the
eliminación de
4 lines
enfermedades
of action and the
que
elimination
hemos
plan
organizado en la
that
Organización
we have
Panamericana de la
organized
Salud.
at the Pan American
También
Health
vamos a
Organization.
demostrar cómo el
We are
tablero
also going to
ayuda a los
demonstrate
países a
how
usar
this
datos para
chart
tomar acciones. Tenemos
helps
datos a nivel
countries use
nacional y
data to
regional,
take
y
action
vamos a
at
compartir la
national and
experiencia
regional
de dos
levels.
países
And we're
en
going to
cómo
share the
ellos están usando
experiences
los
of two
datos para
countries that
monitorear sus
and how they're
acciones
using
en
data
la
to
eliminación de
monitor
múltiples
actions
enfermedades.
in terms of
Hoy tendremos la
elimination of multiple
participación de
diseases. We'll
invitados
have the
de honor
participation
de
of
Costa Rica y
guests of
Panamá,
honor
del
from
Task
Costa
Force for
Rica and
Global Health
Panama,
y de la
from the
Organización
Task Force for
Panamericana de
Global
la Salud.
Health
Yo soy
and
Marta
the Pan
Saboya y
American Health
actualmente soy la
Organization.
asesora
I'm
principal
Martha
de la iniciativa para
Sabuja.
la
I'm the
eliminación de más de
Senior
30
Advisor
enfermedades y
of the
condiciones
Elimination
relacionadas
Initiative
en la Organización Panamericana de la Salud.
in the organization,
Ahora voy a cambiar
Pan
a
American
inglés.
Organization.
I would like to welcome Dr. Rhonda Seeley Thomas, Assistant Director of the Pan American Health Organization, for the opening remarks. Dr. Seeley Thomas, welcome, and the floor is yours.
Good morning, Marta. Thank you so much. It's such a pleasure to be here this morning. I want to also recognize Dr. Silvana Aldigeri, the Department Director for the Disease Elimination Department. I also want to recognize Adrian Cox from EIH, and also to welcome all other PAHO participants, along with the Task Force for Global Health participants and those joining us from the Ministries of Health of Costa Rica and Panama. Good morning again to all, and a warm welcome to all of you joining us today from across the Americas and beyond. It is my pleasure to open this timely and important webinar focused on a topic that is at the heart of our collective efforts to eliminate communicable diseases in the regions of the Americas: the use of data for action. As many of you know, in 2019, the Pan American Health Organization launched the Elimination Initiative, which is an ambitious and unifying effort to eliminate over 30 communicable diseases and related conditions in the Americas by 2030. This is one of the most comprehensive undertakings in public health in our region, and it demands not only sustained commitment, technical innovation, and coordinated action, but also a robust foundation of data as a critical component to guide decision-making. Data is not just something we collect. It is something we must utilize when data are timely, disaggregated, and aligned with programmatic goals. They become one of the most powerful instruments to drive public health actions. The collection of data and its subsequent analysis allows us to see beyond disease-specific silos, to identify where specific actions are required or may need to be adjusted to achieve our targets, ensuring that no one is left behind. In this spirit, PAHO has been working closely on developing digital tools to support countries in tracking their progress to disease elimination. We are proud to have launched 2 interactive regional dashboards under the Elimination Initiative. These dashboards are more than visualizations. They serve as platforms for shared accountability decision-making, and strategic planning. Today, we are especially delighted to present the most recent of these tools, a dashboard of cross-cutting proxy indicators that allow us to monitor progress across the 4 lines of action of the Elimination Initiative in our countries. These indicators give us a clearer picture of where we stand in terms of access to essential health services, equity, community engagement, and the enabling environment needed to accelerate elimination. However, let me emphasize that having a dashboard is only the beginning. What matters most is how we proceed to use the data it provides. This is why today's session is designed not only to introduce the tool, but also to provide you, our country partners, technical teams, and stakeholders with practical insights on how to use these data-driven to drive action. You will also hear directly from countries formulating and implementing national plans and roadmaps for multi-disease elimination and using data available in the dashboards to translate information into targeted interventions that bring us closer to achieving the elimination targets. I want to sincerely thank the national delegates here with us today to share their experiences, the technical experts who have developed and supported the dashboards, and our partners from the Task Force for Global Health and other institutions for your collaboration in this effort. As we move forward, let us remember that data are not only about numbers, but data are about people. Behind every data point is a life improved, a disease prevented, and a community empowered. Let us commit to using data not only to measure progress, but also to amplify it with urgency and equity at the core. Thank you again for being here with us today, and I wish all of you a productive and engaging session. Thank you.
Thank you very much, Dr. Silly Thomas, for the opening remarks and for highlighting the importance of monitoring progress towards elimination of diseases and the need to use data for decision-making to improve the lives of the most in need in our region. Thank you, Dr. Thomas, for that. Now I'm going to shift into Spanish. Mis colegas de la Organización Panamericana de la Salud van a
My
estar
colleagues
compartiendo
from
con
PAHO
ustedes en la
are
cajita
going to be
de
sharing with
preguntas y
you
respuestas
in the
el enlace
question and
al
answer
portal
box a
regional de
link
datos
to the
de la
regional
iniciativa de
data
eliminación. Así que
portal
los
of the
invitamos a
Elimination Initiative.
consultarlo, a
So
navegarlo.
you're
Ustedes
welcome
van a
to
encontrar allí
consult
dos tableros.
this
Uno
box.
que
You'll find 2
monitorea
charts,
los
one
indicadores
that
específicos de
monitors
eliminación de
specific
enfermedades por cada
indicators
una de
on
las más de 30 enfermedades y
elimination
condiciones que tenemos
of
aquí.
diseases
Y
for
tenemos un
each one of
segundo
the
dashboard
more than 30
en donde presentamos
diseases we're following.
información específica
And on the dashboard,
de
you'll find
indicadores de las
specific
4
information about
líneas de acción de la
indicators
iniciativa de
of each
eliminación que hemos
4
estado mencionando
pillars
en
of
este momento.
action
Esto
that
nos
we
ayuda
will
a
be speaking about.
monitorear de esa forma los
This
diferentes
helps us
componentes de la
monitor
iniciativa de
different
eliminación. Así que
components
los
of the
invitamos
Elimination
a navegar.
Initiative. So
Ahora vamos a
we
hacer
invite you
un
to
pequeño
check
quiz
that
para
out.
nuestros participantes
Now, I'll
y
be
explorar
sending
un
a little
poco qué
quiz
tanto sabemos
for our
sobre el monitoreo de
participants
la
to
iniciativa de
get an idea
eliminación.
of how
Así que
much we
vamos a
know
lanzar
about this
tres
Elimination
preguntas
Initiative.
cortas y
So
sencillas que
it's just
ustedes van a ver
3
desplegadas
simple
en sus
short
pantallas
questions that you
en
will
esta
see
sesión de Zoom.
on your
Así que le voy a
screens
pedir a mis
on this
colegas que
Zoom session.
lancemos
So I'm going
la
to
primera
ask the
pregunta.
colleagues here
Jackie,
and to
perfecto.
go
La
ahead
primera
and
pregunta.
yes. Okay,
¿Sabía
first
que la iniciativa de
question.
eliminación
Did you
liderada
know
por la
that the
Organización
Elimination
Panamericana de la Salud
Initiative,
incluye
led
más de 30
by the
enfermedades
Pan American
transmisibles y
Health
condiciones
Organization,
críticas de
includes over
eliminación
30
al 2030?
transmissible diseases and to be
Ahí
eliminated
están
by
nuestros participantes
2030?
seleccionando las
Okay, our
respuestas.
participants are
Muy bien.
selecting
Tenemos cerca de
the
209
answer.
participantes y vemos que el número de personas que están contestando la pregunta
Okay,
sigue
we can see the
aumentando.
number of
Por ahora,
people
el
who are
casi
responding is going
70%
up. Almost
sabía que tenemos más de
70%.
30
We see
enfermedades o
that
condiciones
they
relacionadas.
already knew that we
Y
were
tenemos casi un
taking on over
20% que
30
dice que había
diseases
oído
with
hablar de
these
ella, pero no
initiatives.
sabía cuántas
And the
enfermedades
others say that they
incluía.
had
A
heard
un
about it, but they didn't know that it
14%
included that
no
many
sabía el número de
diseases.
enfermedades y condiciones que incluye. Entonces, la iniciativa de eliminación, como lo
So
hemos
the
mencionado
Elimination
anteriormente,
Initiative,
lanzada en
as we
2019
mentioned,
por la Organización
was
Panamericana de la
launched
Salud,
in
incluye
2019
un
by
poco
the
más
Pan
de 30,
American
son
Health
34
Organization. It
actualmente,
does include
entre enfermedades
specifically
transmisibles y
34
condiciones relacionadas,
transmissible
entre ellas
diseases.
tenemos
and related conditions. We have diseases that are preventable by vaccines, and in other diseases, we're looking to protect the advances we've already made. Sexually transmitted diseases, syphilis, gonorrhea, vectorally transmissible diseases like malaria, uterine cancer, tuberculosis, and environmental determinants, including use of different types of energy. And that's kind of an overview of what's going on here. So let's take a look at the second question. What is your level of familiarity with the Elimination Initiative data dashboards available on PAHO's website? Okay, we've got almost 200 participants. So the possible answers are very familiar. I use them regularly. Second is somewhat familiar. I've consulted them occasionally. And the third option is slightly familiar. I've seen them, but I don't use them. Most of you are saying that you are somewhat familiar and slightly familiar. So I hope that through this webinar, you can become more familiar with these data charts that we have available, the dashboards that we have available, and familiar with the indicators for each disease. And the second dashboard that includes data and indicators related to these four transversal pillars of objectives in this program. So the last question of this quiz, here it is. Okay, progress monitoring. Which of the following elements do you consider useful for monitoring progress toward the elimination of diseases and related conditions? Service coverage, incidence, mortality, investment in health. This is a multiple selection question. So we want to know what elements you find most useful in terms of monitoring progress towards elimination. Okay, so we've got quite a few different responses here. So when we talk about eliminating transmissible diseases, we need a set of indicators that can tell us what are accelerating factors, also indicators that give us insight into impacts and to monitor progress on each of the four lines of action. We need data related to financing and investment in health and environmental risk factors. So all of those factors are important for monitoring. Okay, so we finished the first quiz of the session. We'll end that, and we're going to continue with today's agenda. And I have the pleasure to invite my colleague, Adrienne Cox. She is the chief of the Unit of Analysis of Health, Metrics, and Evidence in the Pan American Health Organization, and she is going to comment on why monitoring transversal actions is important in these elimination initiatives. Adrienne, thank you so much for being here with us today, and I'll give you the floor.
Thank you, Martha, and good morning to the distinguished panelists and also to all the participants that we have with us, almost 250 that we have. So I can see this is of great interest to everyone. I just wanted to speak a little bit about why monitoring cross-cutting actions in the Elimination Initiative is important. So to start off, I'm going to just go through a few slides. I'm not going to bore you with a lot of them, but I just want to go into them a bit. I am sharing my screen with you all. I hope you can see it. Please say yes if you can. in presentation
Yes.
mode? Great. So for the monitoring cross-cutting actions with the indicators that we have, we're all used to monitoring indicators, but with the Elimination Initiative, as you just went over, especially with Martha, we're studying complex indicators for over 30 diseases and conditions. So the idea of having this cross-cutting actions and cross-cutting indicators is really to generate effective and actionable insights so that we have integrated continuous monitoring from multiple perspectives to improve evaluation, guide decisions that support program improvement. Also, we're addressing complex challenges. We want to encourage the holistic and interconnected approach to consider the impact on the whole person as well as communities. And then to understand impact and outcomes. So provide insight into how cross-cutting approaches affect the outcomes and uncover factors that may hinder access to all, that hinder equity and health. But another very important part of this is enhancing the collaboration and building partnerships. So engaging diverse stakeholders, promoting intersectoral collaboration that's based on a common objective and really promotes joint ownership. So hopefully the idea is that all of this enhances program impact. And last but not least, optimize resource allocation. We all know we are dealing in a world of ever decreasing resources, not just financial, but human, as we move things around, as things are very dynamic when it comes to finances and human resources, particularly in health and public health issues. But this allows for sharing of resources and expertise that lead to more efficient use of funds and services if we're doing this correctly and how we envision. So with the elimination indicators, the elimination lines of action really are looked at in whole across the 4 lines of actions. And those indicators coincide and are aligned with PAHO strategic plan indicators and also SDGs. They're also aligned with disease-specific indicators tailored to incidence and treatment, particularly at the country level, surveillance, health planning, interprogrammatic indicators that relate to health service delivery, and again, generating more insight so that we are not looking at things in a siloed fashion, but in an integrated approach, especially to achieve elimination for diseases and conditions that we have here. So we're hoping that this monitoring with the cross-cutting actions really is a well-designed public health initiative. It's not just one initiative, it's many. And they overlap in many ways, depending on what the disease and the conditions are, depending on where the programmatic implementation lies as well. And so hopefully this leads to effective implementation that improves health and outcomes with greater equity. And last but not least, we want to look at these 3 levels, hoping that the Elimination Initiative really drives progress. So you need to get the country content, the regional perspective, and then act on the findings. For the country content, it is critical to integrate the uniqueness of each country context into the design and implementation model in a way that interest holders see the value and utility of the evaluation insights, and then focus on country data at national and subnational levels. At the regional perspective, you have the tools, the various tools, the impact epidemiological indicator dashboards, and tools that provide an overview from the country and regional perspective, identifying trends and patterns, and also convene implementers and partners around a common goal. Now, then we have all these tools, but how do we turn those into action? We need to consider the feedback cycle, clarify intent constantly, not just at the beginning, not just at the end, but it's a continuous process. And also consider the data to action framework. Where does it go in a constant loop of evaluation and feedback to improve and enhance and refine? And to that, I'm going to borrow some language from Gen Z, which I spent a lot of time with this weekend. And I'm going to say, always be messaging. And when I say always be messaging, is how do we communicate the messages? How do we tailor them to the program implementers, to the decision makers, to policymakers, and to the general public? It's not a one-time thing. We're messaging several different groups of people all the time, so that this is not just in the realm of public health from the implementation side or from the professional side, but how do all these things relate to the person and the community in large to improve public health and to eliminate these diseases? So when I say always be messaging, what are we thinking of in that constant communication? How do we communicate these findings to improve things? How do we tailor everything in all the various media that we have out there, particularly social media? So that's what I really want to leave you with in that context. And I will say that it has been extremely rewarding and interesting to work on this project and constantly refine where promoting the, I would say promoting the trust. So working on this and having a lot of trust among the various people that we work with to trust the data, but also have enough trust to question information and data where it's not clear. Because if it's not clear to us, how is it going to be clear to others? So having that open dialogue and forum, and to be willing to self-correct when that is needed. So that's what I want to share with you all, and thank you very much. And I hope this promotes more sharing and insight into the data that we have. Thank you.
Muchas gracias, Adrian.
Thank you very much, Adrian, for highlighting the importance of monitoring in different areas of intervention and the efforts to eliminate diseases and conditions in the Americas. It's an integration process that is quite interesting and not always is completed, but we are promoting across the Americas. So with this, I invite our colleague, Katie Sorhoff, from the Neglected Tropical Disease Support Center Task Force for Global Health. She will help us to navigate this data dashboard from the cross-cutting actions of the Elimination Initiative. Katie, you have the floor. Thank you.
Katie, you are more than welcome, and the floor is yours.
Thank you very much. My name is Katie Zorhoff, and I will be giving a walkthrough of the cross-cutting indicators and dashboard today. I'll start. This is the data portal that had been linked in the chat, and you can see here there's there are two dashboards. There's the one that that Martha had referenced earlier around the progress towards the disease elimination targets. And then we have the second dashboard that we will be walking through today that shows the progress towards the cross-cutting indicator targets. Before I jump into that, I do want to highlight that the dashboard is available in the 4 languages: English, Spanish, Portuguese, and French. And so please feel free as you are perusing this to select the language of your choice. So first we will access the dashboard here. And this dashboard, I'll make the screen larger. This is essentially the landing page for the dashboard around cross-cutting indicator targets. And there are 4 different tiles here. Basically, the 29 indicators can be sliced and diced in different ways. So these 4 tiles are showing different ways of displaying the data. And so we have data organized by the monitoring and action framework for the Elimination Initiative. We have data organized by regional and country status, progress by year, and the indicator domain. And then this here brings us back to that previous page we were just looking at. So we'll start by looking at the monitoring and action framework. Before I get into the specifics of this particular page, I will share a little bit about the how these pages are organized. So at the top, there's the blue bar that shows the those different tabs that we just, or tiles that we saw on the previous page. And so the monitoring and action framework, regional and country status, et cetera. And then beneath that, there is a row of pages that are relevant to the page that you've selected here. So here we can see we have selected the monitoring and action framework, and we are looking at the overview tab. Then along the left is a bar where you can make different selections of what you see. And so, for example, many times you can select data that are showing for a specific subregion or a specific country. You can also select different time periods. And so the latest data, for example, shows the data, the latest data that we have for a particular country and indicator. Now, if we look at this, the content on this page itself, these top cards show the data aggregated to give a high-level summary snapshot for each line of action. So, for example, we see here the first line of action of integrating health systems and service delivery. The overall progress towards the target is 58%. And what happens is every time a country achieves a target, it's included in the numerator for this calculation. And a value of 100% would mean that all of the countries have achieved the targets for all of the indicators that are relevant for that line of action. So this gives a really high-level snapshot of the progress towards the Elimination Initiative lines of action. Then we can see a lot more specific information here below in the heat map. And so in this heat map or heat table, each indicator has a row, and then we're able to see data for each country. And so we can slide over here, for example, and be able to see data for different countries. Dark green means yes, that the target was achieved. A light green means that it's in progress. If it's orange, it means it has not yet been achieved, and blue means partially achieved. And then gray means that there haven't been any data reported for that particular indicator. And so, for example, here we can see that Chile is making a lot of progress for across the different indicators. So that's one of the values of a table like this, is you can look vertically to be able to see progress. You can also look horizontally to see progress for a specific indicator. So, for example, we can see that the inequality adjusted human development index, that there is some improvement that needs to be made across multiple countries. Just to highlight a little bit of what we can see here with the subregions, we can also select and see only the data, for example, for South America. And so that you could see that the countries that were selected here changed, the values that were here changed. We can also select and see just one of the countries. So I can select just Chile again here, and then you can see the values for just Chile. So that gives us the overall snapshot across the monitoring and action framework. We can also see data for specific lines of action, again, organized from a monitoring and evaluation perspective. And so, for example, here, I'll select line of action 3, and what we can see here is that there are indicators for organized by the different M&E levels, so inputs and processes, outputs, outcomes, and impact. And we can see data here aggregated to the regional level as well as to the country level. And so, for example, if we wanted to see, we can select here and see just Costa Rica, for example. So as of 2021, Costa Rica had a policy for ethnic equality in health and was in progress with their capacity to implement social determinants of health policies. And so this really gives a snapshot of what's happening. For those of you like me who like monitoring and evaluation frameworks, you can see the progress from that perspective. However, there's also different ways to look at the data. So we'll look here at the regional and country status next. And so this allows you to select specific indicators or lines of action to be able to see the data for. So for example, I can select here and only see the data that are relevant for line 1, the indicators relevant to line 1. And so you can see here, we have data 1 row per country, and we can see that these are data for 2019. We can also select to see just the Latin Caribbean subregion, for example, and be able to see which countries, for example, have integrated preventive interventions with vaccines in that subregion. In addition to showing the data at that country level, we're also able to see the data aggregated to the regional level here at the bottom of the table. In addition, we have some indicators that have different disaggregations with them. And so, for example, and that's available on the second tab here where it says indicators disaggregated. And so, for example, here, I'll select the indicator of the proportion of the population using safely managed sanitation services. And here you can see a table that has the total values as well as having that information disaggregated by urban and rural where it is available. And so we have data, again, disaggregated where it's available. In addition to that, we can also see data where it's more focused over time. And so, for example, if we select the progress by year and we select the entire region, you can see for this particular indicator, the antenatal care coverage of at least 4 visits, and see that data aggregated at or displayed in a map or also displayed in a chart. This has the functionality as well, where if you hover over a particular country, then you're able to see the value for that country. So for example, here we can see that that the antenatal care coverage, it's associated with line 1, integrating health systems and service delivery. For Mexico in the year of 2022, the actual value was 89.55%. So we're able to see that value shown in a map. In addition to that, there's also the ability to see data in a map over and comparing over time. And so, for example, let's say that we want to see, we'll pick the HPV vaccination coverage. And we'll say that we want to compare data from 2019 to 2021. And so then you can see how these data are updated in the maps, and it makes it easier to compare those data over time. And so, for example, we can say here how Brazil in 2019 had HPV vaccination coverage of 66%, but then within 2 years increased to be over 90% at 99%. So that was quite an accomplishment within just a 2-year period. So that's one of the other features, to be able to compare these data in maps over time. Additionally, we're able to see the data compared over time using a table format. And so, for example, again, I can select specific regions or subregions. So we could select the Latin Caribbean countries again, and then we can select a different indicator around the Ministry of Health having a representative who participates in multi-institutional structure on climate change. And so what this shows, again, is the data over time, but it also adds where there are targets available for the years 2028 and 2030. And so the Elimination Initiative, the baseline year for the Elimination Initiative is considered to be 2019. And then we have data for some of the indicators, including targets through 2030. And this is another example of where many of the indicators that we have are, of course, relevant to health, but then we also have indicators that go beyond just strictly health. So, for example, having Ministry of Health, but the representation related to climate change. And so that represents the holistic and comprehensive nature of the Elimination Initiative. In addition to being able to see data over time, we also have the ability to see data organized by different health domains. And so, for example, we have data here for governance, for financing, for health information systems, service availability and readiness, service coverage, risk factors and behaviors, and health status and equity, and financial protection. And so if you want to see data, let's say we want to see data for health information systems, for example, we have the ability to see that, and we can select the latest data, which again is the most recent data for every country and for each indicator. And with this, we can see, for example, we can go a little broader here, and we can see which countries have information systems for entomological data. So again, this particular indicator is related to health, but not obviously limited to only the health sector. So that's how we can see data that are organized by domain. And then finally, if you want to have a little bit more information about each indicator, you can click on this eye icon and follow the link here. And then this gives overall information about the dashboard itself and the sections. But one of my favorite parts, as someone who loves monitoring and evaluation, is the indicator reference sheets. And so this is where you can select a specific indicator. So here, for example, we have the indicator of whether the country is using vector control to prevent vector-borne diseases. And we have different pieces of information about the indicator. And so which domain it's in, which line of action it's relevant to, which monitoring and evaluation level it is, the overall definition. And then we also have information about how the data are collected at the national level, and then specifically for the EI, what the data source is. And so this can be a really helpful information to be able to get more details about each indicator. And with that, I will pass it over to Martha to walk us through the panel.
Thank you, Katie, very much for navigating in depth the second dashboard that we have for monitoring the lines of action of the Elimination Initiative. We invite all our participants to navigate and explore the richness of the information that we have there. And we are going to answer some of the questions after the panel, because I have seen some questions in the Q&A. And the Task Force for Global Health has been and is one of the partners supporting us on the implementation of the monitoring and evaluation component of the Elimination Initiative. Thank you very much, Katie. And with that, we are going to go now into the panel, and I'm going to switch into Spanish. Bueno, ahora nos movemos a conocer un poco las experiencias de...
Okay, now we're going to get to know about the countries in America's regions using data for decision-making and action implementation, these roadmaps towards disease elimination. It's my pleasure to have these special invited guests from the Ministry of Health of Costa Rica. We have Dr. Roberto Castro. These are from the Health Surveillance Unit, and we welcome Catherine Castillo from Panama. We're going to have several minutes here to dialogue about how data is being used for action in your roadmaps. So Costa Rica is in the process of formulating the roadmap to accelerate elimination of multiple diseases in the country. And we know that it's probable that in the second semester you will be launching this. And the role of regional and national data in the selection of prioritized diseases and the key actions that you are going to include in your roadmaps. So, who would like to answer the first question? Good morning, everyone. I'm going to respond to the first question. For Costa Rica, it's important to let you know that we have a regulatory framework and a surveillance system in terms of health that's quite robust, through which we notify diseases in mandatory reporting. This contemplates all of the diseases included in the initiative, as well as related conditions. Costa Rica, we have 8 diseases, and we are working towards accelerating the other 19 into our action plans for 2030. So what I want to highlight about Costa Rica, we can see early achievements in 6 transmissible diseases. We have rabies transmitted by dogs, and we have objectives for 2026. Hepatitis B transmitted from mothers to children, defecation outdoors, and these are the diseases that we hope to see. Having national data reported by different sources, that we have data reported by the public health sector, Social Security, we have a reference laboratory for human health, we have private health centers, we also have reports related to animal health, and the reference laboratory for animal health, which reports on farm animals as well as other animals. And with this data set, we can see the objectives we have defined and the indicators we are using for these initiatives. This has also allowed us to analyze different data using the integration based on different forms of disease control. So for strategy planning, we are creating a roadmap aligned with our objectives, which are both national and international. Something else that is important is access to regional data through the data portal, which was just presented, which facilitates analysis of these transmissible diseases and related conditions in the countries included. This information allows us to review and adjust national strategies, continuing advancing the advancement towards objectives for the country.
Tenemos un modelo de atención, primero que nada, disponemos de un modelo de atención de salud basado en principios de universalidad,
based on universality principles, solidarity principles, equality, and integration at the territorial level. We have a universal coverage of health services. We do have a historical trajectory in the preventable diseases and health policies. Within those strategies, we have the vaccination strategy, and as regards environmental and social determinants of health, the country has access to drinkable water, basic sanitation with traditional and non-traditional services, and right to public education. Another major action is that we have interdisciplinary teams and interinstitutional teams that are in charge of analyzing periodically the information and the behavior of these communicable diseases, and then to continue the roadmap to elimination. And in turn, we see the situation analysis at the local and regional level with the interdisciplinary teams. Excellent. Thank you, Dr. Dominguez. Oh, sorry. Okay, to end within the line of actions. Costa Rica has been working on a national strategy for digital health for 2023-2030 period, emphasizing interoperability, digital literacy, and data governance. We do have a national strategy plan for HIV/AIDS, and also a national plan for preventing tuberculosis, and a national plan for eliminating malaria. And the state promotes joint coordination processes with civil society and with national and international agencies, especially with the goal of strengthening the actions and strategies implemented in the national territories through this Elimination Initiative. And then we have a national public health policy for the 2023-2030 period with different lines of actions to strengthen the acceleration of the commitment of eliminating these diseases by 2030. Thank you very much. Thank you, Dr. Dominguez, for providing us the framework of the Elimination Initiative and the strengthening of governance of the country that is so important for sustainability. Dr. Castillo, it's nice to see you again. We know that Panama has launched the National Plan of Multiple Diseases in April this year in the framework of the Elimination Initiative. I would like to ask you, Dr. Castillo, which were the main data inputs that Panama used to develop the National Plan of Multi-Disease, the elimination of multi-diseases? Thank you, everyone. Hello. In the case of Panama, this has been a hard work. This has been hard work because we've had a rigorous, multi-sectoral, rigorous process which has been fed with data coming from different sources. We started with the data input from epidemiology, the historical epidemiological data. We analyzed temporal data, health coverage disaggregated by age, region, sex, and other determinants, which enabled us to have a dimension of the real burden of this disease, of the diseases within the plan, and we were able to identify the trends and the gaps in different workshops. We use data by the broad health plan for treatment, diagnosis, and lab work. The entire health ministry devoted to draft through different workshops the elimination plan. Another key input in analyzing the program gaps for diseases with participatory exercises with regional teams, laboratories, surveillance. And within all of these areas, we were able to identify weaknesses in the system, multiple aspects, registry, lack of interoperability of some systems. And what happens in many countries is that there is a lack of technical personnel. And also, the plan focused on many pre-existing commitments, existing plans towards malaria elimination, the national policy of health, the technical guidelines for specific diseases. But something that helped us quite a lot was the regional framework and the international framework as regards what the Elimination Initiative includes, and this line of actions that helped us set the plan in motion. So what we were going to do with the different gaps and all the other programs. Thank you, Dr. Castillo. We know that this was a very complex process. As you have stated, and Dr. Dominguez has also stated, you have been working hard to launch the program. So everything is very interesting. Thank you. So for my colleagues in Costa Rica, Dr. Castro will give the floor. You are about to launch your plan at some point during the second semester, most likely soon. Once you launch that plan, Dr. Castro, the Multi-Disease Elimination Initiative, what do you think are the main challenges to monitor the progress towards the elimination of those diseases? You're muted, Dr. Castro. Okay, now I think I'm muted. Good morning, everyone. We believe that the most important aspect is to keep the institutional synergies of coordination that Pamela has just mentioned, both at the national, regional, and local levels. We have some work with the support of PAHO and some other regional organizations. We believe they are important to strengthen them, to get development of all the initiatives for eliminating diseases by 2030, and especially to achieve sustainability of those interventions with the goal of integrating all of them and trying to upkeep governance and surveillance, basing on interoperability, especially with health institutions from the public and private sectors. We know that we have high coverage, and data interoperability that we have started successfully in the last couple of months has enabled us to move ahead in achieving quality data, complete data, and opportunities for timely decisions. Using quality data and traceable data to progress correctly and to correct in a timely manner the mistakes that may come up, both at the public and the private sectors. It is important to guarantee the intersectorial participation and the participation of the communities, especially by social actors in the implementation of the Elimination Initiative of diseases. Through this roadmap, we can foresee and move ahead in a correct manner in the process that some other countries, like Panama, have achieved to move ahead. This is a unique opportunity that countries need to harness, especially because safety and health of our population will depend on that. And we need to think that the elimination needs to be surveilled. So in case if we achieve elimination of some diseases, it's not that we are going to forget about it. this happened with malaria. We thought that everything was eliminated and it was consolidated, but that was not the case. There are some environmental migration changes that may happen, so we need to be aware. So this timely information will serve as the foundation for sustainability of the data. So thank you for highlighting this approach, the interprogrammatic and intersectoral approach, and the opportunity that the region has to accelerate elimination efforts and to protect the achievements that our countries have accomplished, and we should not lose sight of them. Dr. Castilla, you have already launched a plan. What challenges do you see in conducting the effective monitoring of implementation? Because now implementation begins. What challenges do you see in monitoring the implementation, Dr. Castillo? Well, thank you, Marta. This is quite a challenge. In fact, Panama, we don't see human resources deficit, but to monitor effectively, a world of diseases, because we included 17 diseases, and each disease have their own programmatic targets, operational challenges, and what we do with the plan with this comprehensive approach of the 4 strategic line of actions of surveillance of health determinants and governance and health services is to demand from all the technicians to change the traditional way of working, because they have historically monitored a disease with their own indicators and their own tools and priorities. But now, to have a multi-disease approach requires a cross-cutting approach that enables to monitor the progress by disease, but also the common targets, whether we are strengthening primary care or vulnerable communities, or maybe if the information systems are actually interoperating or we are reaching the gaps of access. But this will entail a cultural and technical change of culture, to stop thinking that they are in silos and to go to common dashboards that are interconnected, coordinated decisions between all the programs. And this is not a simple task because it requires from all the levels, central and regional, to have a shared vision. So this is not just traditional indicators. We include community participation, which involves not just the Ministry of Health, but some other institutions and communities, and equity, equality, social protection, and sustainability in the same plan. So we began with an executive order that considers this a national policy. In our case, our approach was working with the common shared indicators within the plan and promoting, creating follow-up teams in different levels and sectors. And in this process, we believe that the key is not to only measure more, but to measure better and to act jointly. Thank you, Dr. Castillo. You have clearly stated the challenges when it comes to implementing a multi-disease strategy. It's not just one institution, but several. And this goes in line with some of the questions asked in the Q&A. Before going to the Q&A, we'll have a second round of questions so that the participants are still involved. So let us launch the second question of this set to see how we're doing with the elimination. Which of the following which of following is one of the 4 lines of action of the elimination strategy, elimination initiative. We have mentioned them throughout the webinar.
Vamos a ver cómo les va a los participantes.
We're going to see how the participants do.
Muy bien, la mayoría.
Very good.
La mayoría vota por la primera.
Most of you selected the first option. There's 4 options: integrated health systems and services, donation of treatments, basic research, and hospital reconstruction. So in the links that we have sent, we encourage you to respond on our website. We have 4 lines of action. One is integrated health systems and services. Other is surveillance systems. Other is environmental. And the other is governance. So congratulations to all our participants. Because yes, that is correct. Let's go to the second question. Okay, it's loading. Here it is. Second question. True or false? The information on the monitoring dashboard can be filtered by country and by line of action of the Elimination Initiative. Dr. Dominguez, don't give them the answer yet. We've been sharing links to the dashboards in the chat, so we encourage you to navigate them, check out the data, the filters, which are excellent. You can filter by line, by country, by region, by year. So these are dashboards that are very rich in information. Okay, last question. After exploring the dashboard, which feature did you find most useful or innovative? You can select multiple choices: country level filtering, trend visualization by year, access to metadata, and or data organized by lines of action. We have 260 participants who are actively voting, and it seems like almost all of the features that we've mentioned here seem useful and innovative, more than anything useful, which is what we are looking for in terms of decision making and action. So there are some participants here in the chat saying that all of these are useful. Okay, excellent. So all of these options are useful. So we're going to get focused again on our panelists, Dr. Dominguez, Dr. Castro, Dr. Castillo. I also want to invite Adrian Cox and Katie Zaroff to start.
Use the interpretation channel of your preference. Tenemos algunas preguntas y voy a empezar rápidamente con algunas de ellas.
You can use the interpretation of your choice. We have some questions here. One of these questions is for Adrian. One of the questions is about
all this data from cross-cutting indicators from countries, Adrian. Do you want to comment on that?
Yes, I didn't hear the first part.
Is that how we are collecting the data for the cross-cutting indicators?
Yes, very much so. So collecting the data comes from various sources, some of them from the interagency estimates, which of course are consulted and validated at the country level. That is for many of the indicators. The data go through WHO, but they also come to PAHO directly from countries. And other data for several indicators are very specific to countries, and that close coordination and surveillance between PAHO and member states, where countries report the data, and is continuously validated and updated on an ongoing basis. So not just at one time or specific time, but as much as possible on a continuous basis. And the idea is to promote more exchange because data are only as good as the accuracy and the timeliness with which you have the information. It's something one of the other panelists said about, the complex nature of having all of these various data from various sources, having the interoperability and also the ability to access the data at multiple levels, whether it be local, subnational and the department level, province, or nationally and regionally. And the better access we have to information, everyone, the better we understand it, the better we work with it. So that is the idea of these cross-cutting indicators.
Great. Thank you, Adrian. So Katie, the following one is for you. What software is being used for data manipulation and dashboard creation?
Yeah, thanks, Martha. We used Power BI, and we worked with the developer of BAO systems, and they helped to work with us and with and PAHO to develop the system. But it's using Power BI, and then now PAHO is owning and managing that software.
Thank you, Katie. Y es importante clarificar que los datos que estamos colectando.
Thank you, Katie. And it's important to clarify that the data that we are collecting is not new data. It's data that is already in existence and that is being reported through PAHO or the WHO. This is not a new collection. All the data that we have has been built within this framework of the Elimination Initiative. And so we didn't want new indicators because we already had a lot of indicators. That's something we definitely had. So thank you so much, Katie, for that response. And this question is for Dr. Dominguez, Dr. Castro. A colleague, Carolina Navarro, asked, how are we taking into consideration the behavioral factors of people who are making decision for data use? And they shared an article that talks about how decision makers might be tired of seeing so much data that they might be overwhelmed by like how does the person translate this information that they then take into account in their decision making. So how can we take into account the behavior of decision makers when it comes to using this type of data? So this is a question for Dr. Dominguez and Dr. Castro. That's a great question. I think in this context, normally there are different topics in the process with these 30 different diseases that we are trying to eliminate. There's an emphasis on environmental topics and the disease, where there's a vaccine involved, etc. So first we have to be clear about what are the events that we are going to be looking at. And second, we have to look at the different strata of institutions in terms of technical insights in each of these areas. And the information needs to be disseminated in accordance with the level of training and experience of each actor. And on a political level, we have to take into account what we have available. Sometimes if we want to talk about something that we're so excited about, but we need to find the right moment and try to take advantage of big changes in processes that sometimes generate that it make it take a long time to be able to explain, and one might attempt and fail. to explain to the governance. And sometimes sometimes we get so excited that we make a mistake in terms of communicating. So we need to find the right words to explain different processes. So we are rethinking this when there's a failure in this sense and something is not well explained. We need to have a plan in place to get back on track and try again. Yes, and something that we've seen that's very relevant in this, all of this training process that we have for this plan, which has over 30 diseases, is what is the critical information that a decision maker needs to understand not just the chance that we are seeing to eliminate diseases, but also the things that are like proxies. That this is not just a question of having indicators, but how we present those indicators, how we formulate the message for the decision maker. These are key critical messages that I want to thank our panelists for these responses. We have some other questions in our Q&A box, but I just want to thank you so much, Dr. Dominguez, Dr. Castro, Adrian, and Katie, for your participation on this panel. This has been a very enriching conversation with you in terms of how we have been doing this monitoring of this very complex initiative. And we will be answering the rest of these questions after the session. And now we're going to move on to the final part of this webinar. So thank you so much for your participation in this panel. So now we will move on to the last part of the webinar. I will be kindly inviting Dr. Silvan, Director of Prevention, Control, Elimination of Transmissible Diseases of PAHO, to give us some final comments. Thank you so much for being here. Thank you, Doctor. It's always a pleasure, you know. So first, I want to thank our sub-director and director, especially the panelists and presenters, participants from Costa Rica, Dr. Dominguez, Dr. Castro, and Dr. Castillo from Panama for sharing your experiences and what you've learned at a national level. The examples that you've showed us today show clearly that data is a key element for designing, implementing monitoring plans and national roadmaps for the elimination of multiple diseases. I want to highlight the 6 diseases and conditions that are accelerating in hepatitis B, HIV, and contamination of homes by smoke, and also challenges that exist in the countries. These plans, like the ones that have been launched and are in development in various countries, are seeing increased political commitment. These are based on evidences and realities that are local. And our colleague, Dr. Castro, mentioned we can do a better assessment. As with malaria, we need to look at the last stretch of elimination. So in cross-cutting indicators that we're looking at, and this dashboard is a very practical element which allows us to identify gaps and also take a look at what's going on at the level of country management and the challenge of getting information to the populations. So this is a metric that is at the center of our efforts to reach the elimination of these 30 diseases. The organization of PAHO, we are committed to continue supporting countries with data and action and accelerating these comprehensive and strategic plans. We will continue working together to translate these plans into measurable impacts. And as a last comment, I would like to highlight the achievements of our region, which are a bit different than other regions of the world.
Beyond a nice discourse at the global level, the Americas is able to do that. In September last year, we held the lymphatic disease elimination in Brazil, and some other countries like Guyana and the Dominican Republic are making progress towards that target. But today I would like to highlight the fantastic example of Suriname, which has just been certified as malaria-free, is the first Amazonian country to achieve this with a 15-year effort focused on indigenous health. So this is a pleasure to be able to share that information with the entire world, not just with the world, but also with the Amazonian countries, which is a perfect example. Thank you to the 279 participants today. Thank you to the entire support team of the headquarters. Thank you for the task force of global health. It's an honor to share this information with you. Dr. Martha Saboya, I'll give you the floor back. Thank you, Sylvain, for your closing remarks, highlighting so many capacities that we have in the Americas to eliminate diseases and to protect the accomplishments and to accelerate them. It has been quite an enriching session, so we thank all the delegates from Panama, Costa Rica. We would like to thank more than 270 participants that were present today, the technical team of PAHO, Task Force for Global Health for their support, and for Adrian and Katie and all the colleagues and the communication team for the support in the webinar. We'll be sharing the recording in our website. So thank you. Have a wonderful day, and thank you, everyone.